let's do this now. Let's move into something called screening. And that's really kind of the thing that we're going to try to teach you these skills on how to screen. If you don't practice them pretty regularly, like for instance, if Monica goes and she takes all these tests and she's going to do great on all of them, she's going to get her license, but she goes to work in a acute hospital and she's not really seeing these orthopedic patients, it's just not going to be her cup of tea. But then you take Deanna, who is outpatient, and she sees a ton of these very exact these exact patients. It's really hard to kind of keep that going for you. So just kind of keep that in mind. That's just one of the more difficult aspects of therapy. For instance, I have not worked in a hospital in a very long time, and so some of the things that come up in the hospital, they're just not for me. I just don't remember, right? I mean, like, I was really kind of daunted by some of the conversation that happened on Friday and Saturday that I was in on, that was really more specific to hospital stuff. And I was just right there in the mix with some of that orthopedic stuff. I mean, like, it was just like, poof, you know. And so that will happen to you too. But what we know is you can screen these people and you can take a look at them. So let's all kind of get up out of our chairs here for a minute. And you can do this really easy on yourself. Now, first of all, just take some fingers and just palpate where your ASIS is. Right, and then, you know, you can kind of take a look at your lab partner and see, is ASIS, if you put your index finger on it, right, and this is just a great little screen tool, is once you teach your patient how to do this, but if you don't, then obviously you can come up here, your ASIS is right here. And then you can take and say, okay, it looks pretty level to me, right? So why don't you just take a look at your lab partner there, put your thumbs on their ASIS, get used to that. It's kind of an awkward thing, but just see it. Are they level? Okay. Take a look, see if they're level.
There's something going on. Right? It's been a bit. I still remember like the first semester. I know. No. But it's just more.
I was so stuck on the that one. I'm gonna have to find out where I got that.
What if you came in one day and your friend was like,
I would not
lost it?
You need an SI shot.
I didn't lost it.
You need an SI shot?
I think you were probably gonna do something.
I did so many of those at Total Rehab.
Oh, good. Then I'm going to let you take control of that.
All right. You'll have to help me with the terms, but I remember a lot of them.
Well, and I think shotgun is more proprietary to our Therex book. Okay. And that's why I bring it in. That way you've heard of that. They resource our book for the test.
They called it MET.
All right, so how about this one? Can you take a peek at the PSIS? Like that's that, and honestly, what I do is I kind of remember the back dimples. Like that's how I always kind of like get there. That's my landmark to start, right? But maybe you don't have visibility of those. But here's your PSIS. So find that PSIS. Again, what you're doing is you're looking for level. You're not looking, especially if they're standing, because if they're standing and you got an ASIS that's right here and an ASIS that's right here, that tells you something's wrong, right? And then the same is true for the PSIS. You got a PSIS that's right here and then a PSIS that's right here. You're like, whoa, I can see it. And they're like, yeah, my back hurts or my leg hurts. That's honestly, I've had a handful of these SI issues, and it literally is, it's spanned out because it's pulling muscle up here and it's pulling muscle down here, and you get this centrifuge of spasm that just kind of pulls into the butt. And so you have pain up your back, down your leg, and into your butt, and it's really kind of unique too, because you can take your thumb and you can palpate that SI joint and go, oh, yep, they have pain there, right? Another one is you can have them do this test in marching, and what they do is they'll stand here. Now take a look. I'm going to just keep my index finger on my ASIS. What happens when I do a march, right? Now another thing is, if they're really hot, and I don't mean attractive, I mean if their ASIS is, or if their SI joint is pretty on fire, they may not be able to do a single leg stance like that in march. That may be off the table right there, right? And so again, don't do anything that makes them hurt more, pain provoking, right? Okay. And then lastly, the figure 4. Dakari, may I use you again? I just wiped this table down, so everything's clean. All right, so you wear my favorite pair of pants, dude. I mean, I have these pants too.
I can't deal with
I'm
the
not talking about your
handheld fan,
pants.
sorry.
What's that?
I said I can't deal with the handheld fan. That's
I'm just wondering why he's still wearing a hoodie.
yeah.
Somebody get this guy a wife beater to put on here, man.
Black one.
All right, so the last one on that screening is Faber. Am I right, Faber? Okay. So we learned that Thursday, and that's an acronym for flexion, abduction, external rotation, which puts us in the figure 4 position. And what you want to do is you can just put one hand on the extended leg, and I know that may not like jive with you guys because you're all like really educated now on the words extension and flexion. I'm just calling it the extended leg, and I'm taking the flexed, speaking to the knee, and what I'm doing is I'm pushing here. Now again, that pain, if it's SI origin, then it's going to be at the SI joint. If you do this test and you feel it up in the front, number one, it's not even, you just ruled it out, is what you did. You said, okay, they don't have an SI joint dysfunction. If they have pain in the front, they have maybe some hip restriction, but that's not the direction we're going down. We're avoiding that rabbit hole completely. We're saying, okay, good, the SI joint seems fine, right? And so you can rule it in or rule it out with this test. But when you do that, that's a really good quick screen because they don't like it. And you'll see them. They'll win, oh, and they'll really disapprove of you doing that anymore. Okay? So remember your favor, also known as Patrick's, also known as figure 4, which is really easy, right? Another thing that you might notice too is if you were to try to stretch that piriformis. Let's talk about that just for a moment. If you put them into a position to stretch the piriformis, right? And now you bring this leg up, so go ahead and grab that leg and you stretch the right piriformis by doing this motion. And everybody probably remembers how we did that stretch. Then this again too may just be a little pain provoking. I don't expect that it would be. I think that when you tried it, and here's the hardest part for me as a therapist sometimes is I know that some things may help, but I'm a little leery to do them because I don't want to hurt them even more. But listen, again, you might wade off into that water just real slow and see how things go and see if it does help, right? Especially in the midst of a spine where they're so guarded and they act like everything hurts, including sitting. And you're like, I don't know what to do with this patient. And I got to tell you, you're going to be intimidated by that because your heart is that you do no further harm, right? And that's a great heart. But you also have to understand that you're going to have to do something to intervene on their behalf. And so you put them in these positions, like all the textbook said was get them extension, get them extension, get them extension. And you're like, they won't go into extension. What do I do now? Well, put them into piriformis stretch and hamstring stretch and you know, see what happens when you do some of the double knee or single knee to chest. See if you get some symptoms to reduce and just get them calmed down and out of that sympathetic state. Go at it. Throw out your tools and just see what happens. You're probably not going to do further harm in that case, right? You're just seeing what can happen and seeing if you can help. It may not always make sense textbook wise, but give it a try. So you think about it that way. The next thing we look at though